So the topic for today's discussion is periodontal ligament. So as far as periodontal ligament is concerned, what we are going to cover as of today is the structure, or otherwise the components or the contents of the periodontal ligament. Right? So to brush up the so what I'm going to focus on today would be the structure and structural components of your periodontal ligament. All right. So to just brush up the portions which was done yesterday. So what was your periodontal ligament? So periodontal ligament is a soft, specialized connective tissue that is present in between your cementum and the alveolar bone. So between your cementum and the alveolar bone, there is a ligament or a fibrous component which attaches the tooth to the alveolar bone, so that the tooth is anchored firmly within the alveolar socket. So that was a periodontal ligament. So that's a soft tissue. Now there is another thing which is called as periodontium, where your periodontal ligament forms a component, or it is a component of a periodontium. Periodontium is an apparatus which is comprising of different elements, where your periodontal ligament is a component, one component of your periodontium, right? Okay. So now there are other synonyms which are given for periodontal ligament. Among the different synonyms which are there, right, the one that all of you have to be aware of is one which is called as your alveolo-dental ligament. Okay, so what is meant by alveolo-dental ligament? It is a ligament which is connecting your alveolus with your dental or with your tooth. So hence it is also called as your alveolo-dental ligament. Why am I saying? Am I audible to all of you?
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
Okay, right, done. Okay. So now this alveolo-dental ligament is a term which is important. Okay, we will know shortly why this alveolo-dental ligament, the synonym alveolo-dental ligament, is important. As I go into individual structures, you will know why this alveolo-dental ligament is important. And there is another term which is called as gomphosis. Now, most of your textbooks or most of your internet data shows gomphosis is another term for periodontal ligament. But gomphosis does not refer to a periodontal ligament. It refers to a joint. Okay, so all of you are aware of what a joint is. A joint is where two hard tissues meet, and in between this hard tissue, there can be different components. Say for example, your vertebra. Okay, your vertebra, in between two vertebrae, there is something which are called as disc. That's a fiber. That is a disc. In your temporomandibular joint, which was just taught a few days back. Okay, so that in between the temporal bone and your mandible, there is a fluid which is called as synovial fluid. Hence, that was called as a synovial joint. Similarly, the tooth and the bone. Okay, so there is a joint between your tooth and the bone, and in between, or the intervening structure between these two hard tissue, is a fiber. So what is that fiber? That is your periodontal ligament fiber. And hence such a joint where in between two hard structures, if there is a fiber, that particular joint would be called as gomphosis. And hence this tooth within your socket with intervening periodontal ligament or the periodontal ligament fiber is a structure which is referred to as gomphosis, right? So gomphosis does not mean a periodontal ligament. It means a joint or a joint between two bones with intervening fiber, and hence this arrangement is also called as gomphosis. Yes, right. Now the extent and shape of periodontal ligament. So now what you understand is from yesterday's class. Okay, so this periodontal ligament area, how is this periodontal ligament appearing on a radiograph? It should always appear. People, if you can put your audio on mute, it would be better, right? Okay. So this periodontal ligament on the radiograph appears as a radiolucent area, because this periodontal ligament is a soft tissue. So usually soft tissues, you cannot visualize it on a radiograph. I have a lot of disturbance. Please put your audio on mute, whatever it is. Okay. So usually a soft tissue on an X-ray is not visible. So hence it appears as an empty space. So this periodontal ligament here, okay, this is the area where the periodontal ligament is there. So that appears as a radiolucent area or a black area surrounding the tooth. Hence, in a radiograph, you will call the periodontal. You don't refer it to as a periodontal ligament. You usually refer it to as a periodontal ligament space. Okay, when you take a radiograph and when you see there is some problem with the periodontal ligament area, you don't call it as a periodontal ligament. You call it as a periodontal ligament space in terms of either widening of periodontal ligament space or thinning of the periodontal ligament space. And in yesterday's class, madam would have told you the actual arrangement of this periodontal ligament is an hourglass appearance, where the width is more here in the cervical region and more towards the apical region, and the thinness being in the mid root level. Okay, so this is as far as your radiograph is concerned. Now, what happens when the tooth is removed? Now, when the tooth is removed, this periodontal ligament, which is attaching your root to the alveolar bone, okay, is torn off and is attached to the root, and this is how the extracted socket will appear. And what you see, the white line, dark white line, actually refers or actually corresponds to the lamina dura. This white line here, this dark white line here, is actually the lamina dura. Okay, right. Okay. So coming on to the development of the periodontal ligament. So now all of you are aware of the tooth development as such. So the tooth development, the two germ layers are your organ, the dental papilla and the dental follicle. So this periodontal ligament arises from the dental follicle. And what is the timing of this periodontal ligament formation? So we all know that periodontal ligament arises from the dental follicle, but the timing of this periodontal ligament formation is, okay, so it has to start when root formation occurs. So when the hertive epithelial root sheath starts to form and the cementum starts to form, and that is when the periodontal ligament has to form. So the timing of the PDL formation would be coherent or consistent with root formation and before tooth eruption. Okay. So now if you are able to see this picture, now this is the whole tooth germ and surrounding alveolar bone. And this dotted area here represents your dental follicle, and this area within here, this area within here represents your dental papilla, and this area here represents your dental follicle. So this is where your periodontal ligament starts to form. So now where does the periodontal ligament start to form? So it is starting to form somewhere here. That is, this is the cementum, and it starts to attach with your alveolar bone. Now the way I'm drawing the diagram is not the way how exactly a periodontal ligament forms. Okay, so how it exactly it was formed was described yesterday. It starts as a brush from the from the bone, and another fiber starts here, and then they finish somewhere in the middle. So this is where your periodontal ligament starts to form. So this is to tell you the periodontal ligament is arising from your. There is a lot of disturbance from people there. People dropping plates. Please, right on. So the periodontal ligament arises from your dental follicle. Okay, and coming on to the zones of the periodontal ligament. Now, if you can see, so this is the tooth side. This is the tooth side. That is your cementum, and this is your bone side. Okay, so and intervening these is the periodontal ligament area. So now, if you see, the periodontal ligament comprises of three different zones. One zone which is closer to the bone. There is another zone which is closer to the tooth, and an intervening zone which is here. Okay, the zone which is related to the bone are rich in cells. When I say cells, what cells? So the cells of the periodontal ligament. We'll talk about the cells of the periodontal ligament shortly. Then there is a middle zone which has got a lot of collagen fibers. Finally, a zone which is closer to the cementum, which is dense and collagenized. So these are the three different zones as far as the periodontal ligament is concerned. And finally, to brush up with the periodontal ligament homeostasis, now all of you know periodontal ligament is a highly active, metabolically active structure, where the width of the periodontal ligament should always be maintained. So how exactly the periodontal ligament width is maintained? It is by various proteins which are there, so namely MX2, the GLA proteins, the prostaglandins, and the bone osteopontin and the xyloproteins. I'm not going into all of this as of now because it was all done yesterday. So this was all the basics which was done yesterday. And the as far as homeostasis is concerned, so there are a lot of changes which can occur when there is an increased demand, and there are a few changes which can occur when there is a decreased functional demand. Accordingly, the width of the periodontal ligament might increase or the width of the periodontal ligament might decrease. So all of this was dealt with the topic which was covered yesterday, right? So this was just to brush up the whole of the portion which was done yesterday. So coming to today's topic, right? The structure of the periodontal ligament. What exactly would you think would be the structure of a periodontal ligament? Now, till now, we were all studying only hard tissue. Say, for example, we were studying bone, we were studying cementum, enamel, dentin, and things like that. So now coming on to the periodontal ligament, what exactly would you think would be the structure of a periodontal ligament? Okay, so the structure of the periodontal ligament basically comprises of two structures. Okay, so or two things. One is it comprises of cells, and second it comprises of fibers. Okay, or I would compare the periodontal ligament to a mixed fruit jam. Okay, all of you have seen a mixed fruit jam, right? So the gel portion of the jam corresponds to the ground substance, right? And within this gel, you have the mixed fruits, different whatever fruits that are added to the jam. Those individual fruits are the ones which will correspond to the cells. And finally, within that, you have a lot of fibers, because periodontal ligament, as we said, it's a ligament. So within that, you have a lot of fiber. And the function of this fiber is to connect the cementum on one side to the bone on the other side. So you compare this periodontal ligament to a jam, mixed fruit jam, where the gel portion of the jam is the ground substance. So you have the base in which you have all the substances inside. So what are all the substances which are there inside? Number one, you should have cells. Okay, we'll come to what are those cells later. So number one, you have cells inside, and number two, most important thing, you will have the fibers. These fibers are the actual periodontal ligament fibers, which will help connecting the tooth with the alveolar bone. So this is primarily the structure of the periodontal ligament. Two important components, that is the cells and the fibers, which are invested in an amorphous matrix or a gel-like matrix, which is called as your ground substance, right? Okay, so now coming on to the cells of the periodontal ligament. My topic today will not be cells, because cells of the periodontal ligament will be taken by Ramesh sir tomorrow. So I'm going to talk about the other component, that is the fibers, today. But as a question, say for example, periodontal ligament, the structure of the periodontal ligament would be asked as a separate essay question. So you need to understand that you have to write both. Although I am taking separately the fibrous component and Ramesh sir would be taking separately the cellular component, but as an essay question, if the structure of the periodontal ligament is asked, you should be able to write the whole of this. Okay, so what I am going to talk about today would be the fibrous component. Just to tell you what are all the cellular portion. Okay, the cells of the periodontal ligament are categorized into different components. One are called as the synthetic cells, the other are called as the resorptive cells, and then the progenitor cells, and then there is the epithelial rest of Malleus, and finally there are a few defense cells which are also there. And again, I'm not going to cover this topic. This topic would be covered tomorrow, right? So my topic today would be on the other component of the periodontal ligament. So when I say other components, okay, so these are components apart from the cells. So they can also be called as extracellular, meaning those substances which are away from the cell or outside the cell, which are called as extracellular. So which means we are not going to talk about the cells for today. So now as a whole, when you take periodontal ligament, it should have an amorphous gel, which is nothing but the ground substance. Within the ground substance, you have the cells, which we mentioned just before this slide, and then you have the fibers. So those structures apart from the cells would be referred to as the extracellular substances. And these extracellular substances include what? They should include the fibers, yes. They should also include the ground substance, yes, because these do not form the part of the cell. So these two are the other extracellular substances. Okay, so now as far as the fibers, so what are the fibers? So the fibers would be made up of these different components. One, the primary fiber of your periodontal ligament is your collagen fiber. Okay, and then there is a principal fiber. Principal fiber is not different from collagen fiber. This collagen fiber is what is arranged into bundles, and these bundles of collagen fibers are what are called as principal fibers. Then there are other fibers which are called as elastic, secondary, reticular, indifferent, and Sharpey's fibers. We have already mentioned what Sharpey's fibers are. Then coming on to the ground substance, the ground substance basically is made up of three different components. Okay, like any other, even in bone, even in heart tissue also, like in heart tissue also, the ground substance is made up of the form of glycosaminoglycans, proteoglycans, and glycoproteins, right? So now we will go into individual things, right? Coming on to collagen. Now, in physiology, I think in physiology, collagen formation itself is a separate 5-mark question. I'm not sure if collagen formation is done. Okay, so if I have to take collagen formation today, so that itself will take me another 45 minutes. So I'm not going into details of collagen formation. If you want me to talk about collagen formation, then probably we'll schedule a different class and then do collagen formation. So the scope of this class is not to talk about collagen synthesis and collagen formation. By now, you already should know about how collagen is formed. I have a beautiful story about collagen, which probably I think we will share it later. So one of my professor taught me about a story to remember how collagen synthesis happens. We'll talk about that later. Okay. So now what exactly collagen is? So collagen is basically a protein. So when I say a protein, if I ask you a question, which is the most abundant protein in the body, so the answer would be obviously collagen, because most of your places, even in your hard tissues, even on your soft tissues, the collagen is present. So the most abundant protein in your body would be called as collagen. This collagen is comparable to a hair. Okay, so I think I would have told you already in the class, I'm not sure. So if you take hair, girls, you have a huge, a bunch of hair. So usually girls do it as a plait. They take it as 3 different bundles, and then they start twining it with another one bundle to another bundle. So similarly, the collagen is also a triple helix. Each one bundle is intertwined with each other. So that is called as a triple helical structure. So the collagen is a triple helical structure, and each hair, okay, is called as a fibril. And these fibrils are combined together to form a bundle. Okay, and these bundles later intertwine with each other with covalent bonds, so that they become stronger. Okay, so the collagen is a single hair, okay, which is grouped together to form a bundle, and this bundle usually is around 5 micrometers in diameter. And these bundles, or these collagens which form bundles, are actually called as principal fibers. Okay, so please don't get confused with these two terms, collagen and principal. Principal fibers are nothing but the collagen fibers which are there in the periodontal ligament and which are grouped as bundles. Okay, different groups of bundles of collagen in the periodontal ligament are called as principal fibers. Why are they called principal fibers? Because they are the most abundant fibers present inside the periodontal ligament. So when I say principal fibers of a periodontal ligament, it means I'm talking about the collagen fibers. I'm not talking about any other fiber. So the principal fibers of periodontal ligament refers to the collagen which are arranged in bundles. Okay, so now how are these basic of collagen? How are these? When I say protein, when I say collagen is a protein, okay, this should be basically made up of amino acids. Okay, so the primary amino acids which are present in collagen are glycine, leucine, and proline. Okay, so what are the types of collagen? So as of now in humans, there are about almost 20-25 types of collagen which have been discovered. Okay, but what are the major type of collagen which are present in periodontal ligament? So the predominant type of collagen which is present, predominant type of collagen which is present in periodontal ligament is your type 1. Type 1 occupies more than 70% of your collagen in periodontal ligament, and the rest is about type 3. If you remember alveolar bone, which I took in the previous class, we said alveolar bone is also made up of type 1 collagen and a little bit of type 3 collagen. So where exactly was this type 3 collagen present? Okay, so this type 3 collagen was present in the Sharpey's fiber. Okay, this Sharpey's fiber is actually made up of the type 3 collagen. So the primary bundles of collagen are made up of type 1 collagen, and type 3 collagen is actually present in the Sharpie's fibers. Now, if you again remember alveolar bone, we said Sharpie's fibers. And why are we talking about Sharpie's fibers everywhere? Okay, we read the Sharpie's fibers in cementum, we read Sharpie's fibers in alveolar bone, and again we are reading Sharpie's fibers in periodontal ligament. The reason being, the Sharpie's fibers are nothing but they are the end portions of the periodontal ligament which have inserted into the cementum and inserted into the bone. So, which means, so when we read cementum also, Sharpie's fibers would be a part of cementum. When we read bone also, Sharpie's fibers would be a part of bone. So when we read periodontal ligament also, we are reading about Sharpie's fibers. Okay, so that is why we are reading Sharpie's fibers in all the three different topics, because they are a part of periodontal ligament which have inserted into the cementum and to the alveolar bone, right? So coming on to the type of collagen, the primary collagen is type 1 and 20 to 30% of your collagen is type 3. People, are you there?
Yes, sir.
Yes, sir.
Yes,
Okay.
sir.
Yes, sir.
No, problem is I'm having a pin drop silence, so I'm not sure if people are there. Okay, right, very good. Right. So you have type 1 collagen and type 3 collagen, type 1 being the predominant collagen and type 3 being the rest of the collagen, which is primarily in Sharpie's fibers. Okay, so now if you can see this picture, a black and white picture, so these, can you see these fibers here which have a wavy course? Okay, so these fibers are actually the collagen fibers, and what you can actually appreciate in this collagen fiber is in between in one fiber, if you see, can you see striations which are there in collagen? So these striations are characteristic of collagen, and where and how frequently these striations occur will decide whether what type of collagen it is. Usually collagen, if I have a fiber like this striations usually occur at an interval of 64 nanometers. Okay, that is why everywhere when you read about collagen, they say this is collagen because of the characteristic striations at the interval of 64 nanometers, which is characteristic of collagen. Why this 64 nanometer? We have to talk about basics of collagen formation. If I have time, then we'll talk about collagen formation later, right? So this fiber which has got cross striations at an interval of 64 nanometers is characteristic of collagen. So this is exactly how a fiber is there. So on the left side is your bone, on the right side is your cementum. If you see, the fibers are inserting like this. Okay, so this is a longitudinal section. Suppose if I cut the fiber cross section, so you will see fibers as something like this, right? So you will see, when I cut it in a cross section, so this is how you will see these are the fibers, these are the ends of the cut ends of the fibers that you are able to see. This is how a collagen fiber will appear. Okay, so now a little bit of basics of synthesis of collagen. That's why I said, so now when I say collagen, okay, so this collagen should have been synthesized by a cell. Which cell actually synthesizes collagen? The fibroblast. Now, so hence when I say fibroblast synthesizes collagen, the fibroblast should be a part of your periodontal ligament. When I say fibroblast is a part of your periodontal ligament, we said there are cells of your periodontal ligament, namely your synthetic cells, resorptive cells. So fibroblast is the primary cell of your sorry, excuse me. So the fibroblast would have been the most important or the primary synthetic cell which is there. Okay, so fibroblast should be one of the cell of your periodontal ligament. So the fibroblast synthesizes something which is called as tropocollagen, which forms the microfibrils. Okay, so these microfibrils now will form the fibril, okay, which is nothing but a hair-like structure. Okay, these fibrils join together to form fibers, and finally they form the bundles. So this is the structure here. If you see, you have a microfibril inside, then you have the fibril, and all these fibrils join together to form bundles, and these bundles again will cross-link together to form a huge collagen bundle. Okay, so this is basically a synthesis of collagen. Okay, so now we have spoken about the basics of collagen. What collagen is? Collagen is actually a protein which is a combination of amino acids. What amino acids are there? How do you appreciate histologically? What is the what are the how is it forming? Basics of how is it forming? And finally, these collagen are grouped together to form bundles, and these bundles are what are called as principal fibers. Okay, so now what do you understand by principal fibers? Principal fibers are no different from collagen. Principal fibers are the collagen fibers, but the collagen fibers which are grouped together to form bundles, and they are given different names based on their location and based on their function. So these are called as principal fibers. Okay, now if you go back, I said one of the important synonym of periodontal ligament is alveolo-dental ligament, correct? So why was it called alveolo-dental ligament? Because it is arising from the alveolus and running to the tooth, that is the cementum, and that's a ligament. So this principal fibers can also be called as alveolo-dental fibers. Okay, so sometimes in the exam, instead of asking as principal fibers of the periodontal ligament, the question would be alveolo-dental fibers of the periodontal ligament. So it is nothing but they are asking about the principal fibers of your periodontal ligament. So now if you see these principal fibers, that is the collagen fibers, are grouped together to form different groups, and they are given names called as alveolar crest, horizontal, oblique, apical, and interdental. We'll talk about each one of them now. Okay, so these are the 5 different groups of principal fibers, that is alveolar crest, alveolar crest fibers, the horizontal fibers, the oblique fibers, apical fibers, and the interdental fibers, interdental septal fibers. Now, as far as periodontal ligament is concerned, one of the important 5-mark question or a short note question is principal fibers of periodontal ligament. So this is what is very, very important. And again, I'm running short of time. I have another 8 minutes left. So if this session disconnects, please log in using the same ID which I shared yesterday. Okay, so with what you logged in today, so you can share, you can log in with the same ID immediately. Okay, right. So these are the 5 groups of principal fibers. Okay, so now what you have to understand is the names. So this chart, okay, so if the question is on principal fibers, this one chart with a picture is more than sufficient for you to score complete marks. Okay, so what you need to know about all these is you need to know the names, the 5 different names, the origin. So if I'm talking about a fiber, just like how you read about a muscle in anatomy, you need to know its origin, and you need to know the insertion, and you need to know the function, the significance. Similarly, you have the name of the fiber, the origin of the fiber, the insertion of the fiber, and the significance of the fiber. Now the origin and insertion obviously would be, origination would be from the cementum and insertion would be to the alveolar bone. Okay, so it's not going to be any different, but the location is what is different in each one of the groups. Okay, so now if you see, the first one is called as alveolar crest fibers. Okay, so all of you are able to see one line diagram which is on the right side of your screen. Okay,
yes, sir.
Right, okay.
Yes, sir.
So the name is alveolar crest, okay, fibers. So these fibers start from the cemento-enamel junction and they run and insert onto the crest of the alveolus. Yes, they start from the cementum and they insert onto the crest of the alveolus, correct? So these fibers are called as alveolar crest. Okay, so they start from the tooth, that is the cemento-enamel junction, and they run and insert into the crest of the alveolar bone. So these group of fibers are called as alveolar crest fibers. So the origin is cementum, just below the cemento-enamel junction, and insertion is onto the alveolar bone. So they start here, they run downwards and outwards. Okay, so they run downwards and outwards toward the bone and get inserted onto the crest of the alveolar bone. What do you think would be the function? What do you think would be the function of this periodontal ligament fiber? Now, as far as function is concerned, very simple. The function of a periodontal ligament is to hold the tooth firmly within the socket. So, which means it should not allow for any type of movement of your tooth. So what do you think would be the primary function of this periodontal ligament fiber? Simple, it should not allow the tooth to come out of the socket. The primary function is it should not allow the tooth to come out of the socket. So that is what is called as extrusion. Okay, it should not allow extrusion, or the function is it prevents extrusion of the tooth from the socket, and it also resists lateral movement. Okay, so this is the primary function of your periodontal, this alveolar crest of fibers, correct? Okay, coming on to the second group. So these group are called as horizontal. So as the name horizontal is there, very simple, they lie horizontally. So now the origin is from the root at cementum and they run horizontally and insert onto the alveolar bone. Okay, so this is the direction of your horizontal fibers. So these are the horizontal fibers. So now uh, uh, it's a two-dimensional picture, so I'm only drawing it on one side, but you'll have to appreciate this is all around the tooth. Three-dimensionally, you'll have to appreciate this thing is present all around your tooth. So these are called as horizontal, which lie horizontal, starting from the cementum and inserting onto your alveolar bone. So now if you see the origin, it arises from the cementum below this group of fibers, okay, starting from the cementum and inserting onto the alveolar bone. So they run at right angles to the cementum and the alveolar bone. So what is the significance of this particular fiber? So they resist horizontal movement, okay, side to side movement, okay, they resist horizontal movement and tipping forces. Tipping meaning like when you bite your apple, okay, there is a tipping movement on your tooth which is there, so it will resist tipping forces on the tooth. So this is the second group of fibers. Then the third group of fibers, which are called as oblique fibers, which are very, very important because they form the bulk of the principal fibers. Now, you know, the bulk of the fiber of a periodontal ligament is made up of collagen. And in collagen, what is the what is the bulk of the principal fiber? It is the oblique fibers, okay? So as the name indicates, oblique meaning they're not running horizontally, they're running in a oblique direction. So oblique direction meaning they start from the cementum and they run upwards and get inserted onto the alveolar bone. So this is very, very important because I cannot draw it something like this. Okay, all of you understand? It runs from the cementum and goes upwards and gets inserted onto the alveolar bone. Okay, so these are oblique fibers. When I say this, I have another 1 minute only left. So if it is disconnecting, please log in immediately using the same ID, right? Okay. So these are the oblique fibers which run in an oblique direction, and these form the bulk of the principal fibers. They start from the cementum, run upwards and get inserted onto the alveolar bone. Okay, so this forms the largest group. If you see here, this forms the largest group, and the important function is it resists vertical masticatory forces so that it doesn't allow the tooth to intrusion meaning opposite of extrusion. That doesn't allow the tooth to intrude inside, because when you when you keep biting, the tooth cannot constantly move inside and outside. Okay, so it cannot happen. That cannot happen. So this group of fibers prevents the intrusion. Okay, this is the largest group and the important group, and it prevents insertion. And what you'll have to understand is this arrangement is wrong. Okay, so this kind of arrangement is what is right, so which means it runs from the cementum in an upward direction and ends into the alveolar bone. Okay, people, are you there?
Yes,
Yes,
sir.
sir.
Yes, sir.
Yes, sir. Yes, sir.
No, I think